Today, we're going to talk about something incredible. We're not just talking about an organ, we're talking about a silent guardian, a protector that's working inside you right now. We're talking about your liver.
I mean, seriously, just think about that for a second. What if you had a personal superhero fighting battles for you that you don't even know are happening? Well, guess what? You do. And understanding how it works and what threatens it is absolutely crucial.
And that unsung hero? Yeah, it's your liver. It is without a doubt one of the most complex, most hardworking organs in your entire body, juggling hundreds of vital jobs every single day. I mean, just look at this job description. It's insane. It's a protein factory, it's a detox center filtering everything you put into your body, it's a pantry storing up energy and nutrients for later. It's an absolute powerhouse, and it's doing all of this right now without you even thinking about it. And that's the catch, right? Every hero has a weakness. Despite being incredibly tough, the liver can be damaged. And the scary part is, it often suffers in total silence until the damage is already pretty severe. So let's break down the threats it faces in a really simple way. So how do we even begin to wrap our heads around all the things that can go wrong? Well, there's actually a pretty simple trick that doctors use, a mnemonic called the ABCDEs of liver disease. It's a fantastic way to categorize all the major causes of trouble. So here's the breakdown. A is for alcohol and autoimmune diseases. B covers blood-borne viruses like hepatitis. C is for things like cholestasis, which are bile duct blockages, and cancer. D stands for drugs and toxins, and E is for everything metabolic. Now, while they're all super important, today we're going to zero in on two of the biggest and most common threats, A for alcohol and E for everything metabolic. So let's dive right into A. Alcohol is probably the most famous cause of liver damage. But here's the million-dollar question. How much is too much? Well, the guidelines are actually way clearer than you might think. 14. That's it. That's the number to remember. In the UK, health experts recommend no more than 14 units of alcohol a week. That goes for both men and women, and it's the guideline for keeping health risks low. Okay, but what does 14 units actually look like when you're holding a glass? Well, it's about a bottle and a half of wine, or 6 pints of a regular strength beer, spread out over a whole week. You know, seeing it laid out like this can be a real eye-opener. Now, this is a really key distinction to make. There are different levels of risk. Hazardous drinking is when you're going over that 14-unit limit. You might feel fine, but you're definitely increasing your risk for the future. Then there's harmful drinking. That's when the damage is already starting to show up, maybe in your blood test or even affecting your mental health. And then you get to the most severe stage, alcohol dependence. This isn't just a bad habit anymore. It's a clinical condition. We're talking about a powerful craving, losing control over your drinking, and even physical withdrawal. This is where the risk of serious, life-threatening liver disease just goes through the roof. All right, so we've talked about the classic villain, alcohol. But there's another major threat, a much more modern one, and it's on the rise. Let's jump to E for everything metabolic. This is all about a huge, growing problem called non-alcoholic fatty liver disease, or NAFLD. And yep, it's pretty much exactly what it sounds like, liver damage that has nothing to do with booze. See, NAFLD is best friends with something called metabolic syndrome. And that syndrome has a whole crew of risk factors. We're talking about things like high blood pressure, high blood sugar or diabetes, and carrying extra weight, especially around your waist. It also includes having out-of-whack cholesterol levels, specifically high triglycerides and low levels of that good HDL cholesterol. All these things are connected, and they put a massive strain on your liver. And this is where it gets really serious, because NAFLD doesn't just happen overnight. It's a slow, silent progression. It starts quietly with just a little extra fat building up in the liver. But then, that can lead to inflammation, a condition called NASH. From there, actual scarring or fibrosis can start to form. And the final stage? Cirrhosis. That means severe, permanent scarring, and that damage is irreversible. So, what's the big takeaway here? It's pretty simple, actually. Knowledge is power. Just understanding these risks from both alcohol and from our modern lifestyle is the single most powerful first step you can take to protect that silent guardian inside you. So let's just run through that code one more time, because this is your takeaway tool. ABCDE. It's your mental checklist. Keep an eye on alcohol, be aware of viruses, understand that blockages and other issues can happen,
think about the drugs and toxins you're exposed to, and manage your overall metabolic health. This simple framework really does cover the most important bases.
And if you need one final, stark reminder of why this all matters, just listen to this. In patients with severe alcohol-related liver inflammation, 100% of them are malnourished. A third of them, severely so. It just goes to show you, the liver is so central to everything that when it starts to fail, your whole body's nutritional system just collapses. So I'll leave you with this final thought. Your liver works around the clock, and it almost never complains. The first signals that something is wrong can be incredibly quiet. Knowing the risks is the key to finally hearing those signals so you can protect your internal superhero before it's too late. So the question is, are you paying attention?